This is case study 13-1. MT, a 60-year-old gravida, para 2, had spent 3 months under the care of her gynecologist for treatment of postmenopausal bleeding and cervical dysplasia. She had several vaginal examinations with pap smears, a urine ultrasound, colposcopy, and an endocervical biopsy, and a DNC with cone biopsy. She wanted to take hormone therapy, but her doctor thought she was too much at risk with the abnormal cells on her cervix and the excessive bleeding. She had a TAH and a BSO under general anesthesia with no complications and an uneventful recovery. Her uterus had been prolapsed on abdominal examinations, but there was no sign of malignancy or PID. The pathology report revealed several lyomas of the uterus and stenosis of the right oviduct. She was discharged on the second post-operative day with few activity restrictions. Case study 13-2. CA had worked as a technologist in the IVF lab at University Medical Center for 4 years. Her department was the Advanced Reproductive Technology program. Although her work was primarily in the laboratory, she followed up each patient through all 5 phases of the IVF and embryo transfer treatment cycle: follicular development, aspiration of the pre-ovulatory follicles, sperm preparation, IVF, and embryo transfer. Her department does both GIFT, which is gamete intrafallopian transfer, and ZIFT, zygote intrafallopian transfer procedures. While the female patient is in surgery having an ultrasound-guided transvaginal oocyte retrieval, CA examines the recently donated sperm for motility and quantity. She prepares to inoculate the sample into the cytoplasm of the ova as soon as she receives the cells from the OR. After inoculation, she places the sterile petri dish with the fertilized oocytes into an incubator until they are ready to be introduced into the female patient. Case study 13-3. AY, a gravida 2, para 1, at 39 weeks gestation, had been in active labor for several hours, fully effaced and dilated, yet unable to progress. She had an uneventful pregnancy with good health, moderate weight gain, good fetal heart sounds, and no signs or symptoms of pregnancy-induced hypertension. X-ray pelvimetry revealed CPD with the fetus in right occiput posterior position. Changes in fetal heart rate indicated fetal distress. AY was transported to the OR for emergency C-section under spinal anesthesia. After being placed in the supine position, AY had a urethral catheter inserted and her abdomen was prepped in with antimicrobial solution. After draping, a transverse suprapubic incision was made. Dissection was continued through the muscle layers to the uterus with care not to nick the bladder. The uterus was incised through the lower segment, 2 centimeters from the bladder. The fetal head was gently elevated through the incision while the assistant put gentle pressure on the fundus. The baby's mouth and nose were suctioned with the bulb syringe and the umbilical cord was clamped and cut. The baby was handed off to an attending pediatrician and OB nurse and placed in a radiant neonate warmer bed. The APGAR score was 9 out of 9. The placenta was gently delivered from the uterus and scrub nurse checked for 3 vessels and filled 2 sterile test tubes with cord blood for lab analysis. AY was given an injection of pitocin to stimulate uterine contraction. The uterus and abdomen were closed, and AY was transported to the PACU, post-anesthesia care unit. Number 1. MT is a gravida 2, para 2. This means B. She has had 2 pregnancies and 2 births. Number 2. An endocervical biopsy is D. A tissue sample from the lining of the cervix. Number 3. A curettage is B. Scraping. Number 4. A colposcopy is an endoscopic examination of the, vagina. Number 5. Another name for a lyoma is E, which is both B and C, uterine fibroid and myoma. Number 6, pregnancy-induced hypertension is also called D, preeclampsia. Number 7, the occiput of the fetus is C, back of the head. Number 8, pitocin is the trade name for E, oxytocin. And then 9 through 14, write a term from the case studies with each of the following meaning. Number 9, displaced, I said dysplasia. Number 10, cell produced by fertilization, I said zygote. Number 11, measurement of the pelvis, pelvimetry. Number 12, Upper rounded portion of the uterus, the fundus. Number 13, method for rating a newborn's physical condition after birth, or physical condition. I said APGAR score, and then number 14, after birth, I said was placenta. And then 15 through 23, define each of the following abbreviations.